Good evening. I am Ellis Dean, your host from blackdoctor.org. Thank you for joining us for this important conversation, one that could save your life. We're back with another panel in partnership with Cedar Sinai as we discuss the latest information about women and heart health, including prevention tips, as well as the latest on screening, diagnosis, and treatment. Today's discussion is also available via simultaneous interpretation on our Daily Vitamina Facebook page. We're talking about women and heart health because it is one of the leading causes of mortality among women in the United States. And because we know that Black Americans are at a higher risk to be diagnosed with high blood pressure, diabetes, and obesity, which are all risk factors for heart and blood vessel disease. We're also talking about women's heart health tonight because heart disease may present differently than for men. Our expert panelists today are here to give us the facts and to discuss the latest screening tools and treatments to give our viewers all the latest information about heart health and women. So, here are the facts from our friends at Cedar Sinai. Cardiovascular disease ranks number one in the causes of death among women. Number one. There are 8.6 million American women currently living with heart disease. 2 out of 3 American women have at least one risk factor for heart disease. 1 out of 2 American women will develop heart and vascular disease. 12 times the number of women die from heart disease than from breast cancer. Think about that, 12 times. 455,000 women die of heart disease each year, compared with 410,000 men. Among women who have suffered one heart attack, 35% are at risk for a second attack within 6 years. Among women who experience early warning signs of a heart attack, 71% do not display typical male symptoms. We're going to talk about that a little bit more as part of this program. 67% of women who die from heart attacks have no history of chest pain. Only 4% of the National Institutes of Health budget is dedicated to heart disease prevention through healthy lifestyle changes. 4%. Only 24% of participants in all heart-related studies are women, despite the fact that heart disease in women is an epidemic. We're going to talk about all of this, but first, let's meet our panel. Dr. Noelle Berry Mertz is the director of the Barbra Streisand Women's Heart Center at Cedar Sinai. Dr. Janet Way is the co-director of the Stress Echocardiography Laboratory and assistant medical director of the Biomedical Imaging Research Institute at the Streisand Women's Heart Center at Cedar Sinai. You got to say that, echocardiography. You got to say that 5 times real fast. That's tough, okay? And we have Cynthia Mayweather. She is a resident of Los Angeles and a Cedar Sinai Women's Heart Center patient who will share her story of a cardiac treatment and recovery. We've got a lot to talk about, so let's go ahead and get started. And we'll start with you, Dr. Berry Mertz. First question. I went through the numbers as part of my opening. Can you tell us why it's so important to teach women and healthcare providers about heart health?
Thank you so much, Ellis, and that was a fabulous introduction and setup. We want to do this because when we do polls, surveys of everyone, women, including men, but women in particular still believe that breast cancer is their leading healthcare threat. And women overall now, 3% die of breast cancer, where 1 out of 3 women in their lifetime, as you said, will have heart disease as a condition. 1 out of 4 will die of heart disease. So that's 25% compared to 3%. And it's not because we don't like breast cancer. In part, we like breast cancer profiling to show what happens when women aggressively go after a disease. For example, women are quite compliant. They get mammography regularly. The physicians detect breast cancer and treat it. And this is not just sort of random stuff. This is, 50 years of research and education and excellent treatment. So we want women now to own their hearts, to acknowledge that heart disease is their leading health threat, and do the same kinds of community and physician action to reduce the threat of heart disease, similar to how we have reduced the risk of breast cancer.
So, Dr. Way, what are the main risk factors for heart disease in general and especially in women?
Yes, that's a really good question. In general, we think about the traditional risk factors for heart disease, and you can simplify it down to kind of life's simple seven. This is from the American Heart Association. Is number one, smoking. Quit smoking if you're smoking. Try not to get exposed to secondhand smoke. Number two is nutrition. Try to follow a Mediterranean style nutrition. Number three is lack of exercise or lack of physical inactivity. So we encourage people to get their steps in, to perform not only aerobic exercise, but also weight resistance training. Number four is obesity. If you have a high body mass index, you are at risk for being classified as obese. And so there are studies that show that losing weight is important for improving your cardiovascular health. Number five, which probably is the most important, is blood pressure. Hypertension or high blood pressure is very prevalent in the American community. At least 50% of the adult population probably has high blood pressure. So knowing your blood pressure numbers is very important. Number six is high cholesterol. That's another know your numbers. Know what your bad cholesterol is. Your LDL is the one that you actually want to get low. So low density lipoprotein, or LDL, is the bad cholesterol, and you want to know what those numbers are. Blood sugar is number seven. Know if you are pre-diabetic or diabetes, because diabetes is a risk factor for heart disease. Those are kind of the simple sevens for general risk factors for heart disease. But in women, we also know that there are some sex-specific risk factors that they should be aware of. Number one, if you had a pregnancy and experienced what we call an adverse pregnancy outcome, meaning you had high blood pressure during pregnancy, or had something called preeclampsia, or even delivered preterm, your baby was delivered more than under 37 weeks, that is a risk factor for future cardiovascular disease. Also, women are more often likely to experience some sort of autoimmune disease compared to men. So if you have autoimmune conditions like lupus or rheumatoid arthritis, that is also a risk factor for heart disease in women. And then lastly, women who experience breast cancer and are undergoing potentially cardiotoxic chemotherapy or radiation, they should have a higher awareness for heart risk factors and symptoms.
I like that, the seven. So you got to remember those seven. You got to know your numbers. And then for women, there's a little bit different. There's some factors that are gender specific. And so you might want to kind of know those factors as well. So Dr. Wade, thank you for that. That was fantastic. Just kind of really laying it out. Know those seven, start with those seven, and then as a woman, add those additional factors to it. So those are the risk factors. Dr. Barry Mertz, what are the warning signs, right? Because we know, well, those of us that watch movies, right? Okay, we get the movies, right. And we say we get that, and I'm old enough from Fred Sanford, so with like when you grab it, he said, "It's a big one." Yeah. I know it's not like that in real life. So, what are the risk factors in general, and then are there specific risk factors that women might be experiencing?
So, of course, most people know from Hollywood, as you suggest, clutching your chest, falling over, dead. That's the Hollywood heart attack. And that is characteristic of about 2/3 of men, but it's characteristic only about 1 out of 3 women. Women are more likely to complain that they think their stomach is upset. They might be short of breath. They might have shoulder, arm, or jaw pain. They might feel overwhelming fatigue. And so one of the things that we're doing as a public health campaign is if there's anything really above your belly button, above the waist, that is uncharacteristic for you, you should be speaking with a healthcare professional. Most medical centers have hotlines. Call your primary care physician, call your cardiologist, and run it by them. For folks that always have, stomach upset, gastroesophageal reflux called GERD, after, say, they've eaten 2 Dodger dogs at 2 a.m., I don't want to hear about that, right? That's expected. That's something that is at your waist or above, but it's expected. We want to hear about something that's different, above the waist. And if we do a better job examining all of these symptoms, shortness of breath, undue fatigue, arm, jaw pain, as well as chest pain or chest pressure, not only will we help those 2/3 of women and how they present with their heart disease and heart attacks, but we're going to help that 1/3 of men. And as you said, Ellis, in the beginning, we're talking about hundreds of thousands of people in the United States having heart disease and heart attacks every year. So 1/3 of men is also a lot of men. It's a lot of women, but it's also a lot of men, and we'll do a better job for everyone.
That seems to be so amazing. Like, it's like how the symptoms present so differently, and it's not out there, right? So that's why we're doing this program. That's why we're here trying to tell people about it, because the expectation is you get that pain in the left arm, you get some chest pain, and that's it. And it's really not. I mean, I wouldn't expect jaw pain to be connected to heart disease. And so once we recognize those things, follow up to that though is you might present with those symptoms to an urgent care, an emergency room. Can we be certain that they're going to catch that and connect it to heart disease, or they're going to connect it to indigestion, stress, anxiety, all these other things and they might get discharged without having their heart checked? How common is that?
So we think it probably was fairly common until we got going on this campaign, and we're almost entering 30 years. So we'll be beginning our 3rd decade of National Heart, Lung, and Blood, your tax dollars at work, as well as our societies, the American College of Cardiology, the American Heart Association, educating our physician workforce, as well as our nurses, our respiratory technicians, et cetera. There are questions now on the boards for all of these certifications. We've worked really hard to ensure, teachers teach to the test. I mean, doctors and nurses are not any different from the rest of us. They have to take tests.
Right.
Now, is it perfect? No. And that's why arming the community to be their own best advocates, because it takes time. It takes time to educate folks. And this broadcast is an example of that. Very important and necessary community education.
So that sounds like it's a two-way street. We're educating and testing and updating our healthcare providers, which they should be if you're going to continue to practice. But also on the community side, we've got to be educated ourselves, and we've got to be an advocate for ourselves and recognize what's going on, because you are the best advocate. You are the best person that knows about what's happening in your body. If you've got pain, you know it, and you have to express that. And so if there's something that's unusual going on and you're not feeling satisfied by what's being, seek another opinion, right? And so make sure that you get it taken care of, because we don't want to have that Hollywood ending, which is sad for you, when it can be taken care of.
Well, and to think about it, because, women and men are gendered, and I'm not saying every single woman and every single man thinks this, but there certainly is a bit of a culture of women helping everyone else first.
Yeah.
It's the children, then it's the husband. Sometimes the dog is ahead of the women's healthcare needs, running around to the vets, right? And so the coin that we like to use, the phrase, is similar to when you're taking off on an airplane and they're instructing you about the oxygen. Put your own oxygen on first so that you can help others. So to women, take care of your heart health first so that you'll be there to take care of those loved ones, and the dog.
Absolutely, because I would say you cannot pour from an empty cup. So if you are stressed out, if you are beat down, if you are broken down, you can't help anybody that you want to help.
You're not
But
there. Yep.
You're not there. So, Dr. Way, what are some of the new treatments and tools being investigated at Cedars-Sinai for women regarding heart health?
Yes, thank you, Ellis, for asking that question. For many years now, thanks to the National Heart and Blood Study, the Women's Ischemia Syndrome Evaluation led by Dr. Barry Merz, where we're trying to understand how ischemic heart disease or chest pain presents in women, we have learned that 2/3 of women who have chest pain, when we think that it's heart pain, actually do not have any major blockages in their arteries. And many of those women who have no blockages but still have persistent chest pain and signs that there's poor blood flow in their heart actually have a condition called coronary microvascular dysfunction, which is a condition where the small little vessels that we can't even see in our heart are not working well. They're not increasing blood flow adequately when it needs to, for example, when we exercise or when we're under stress. And we now have ways to diagnose this condition non-invasively using imaging techniques called a cardiac PET scan or a cardiac MRI. These are ways that allow us to look at blood flow changes to the heart and help us diagnose the function of the small little vessels. But also in the cath lab, if someone has had just multiple prior stress tests or prior angiograms, and someone's told you, your arteries look fine, there's no blockages, your stress tests are normal, but you're still having this chest discomfort, then sometimes more advanced testing is needed. And so Cedars-Sinai is one of the sites that allows us to perform something called invasive coronary function testing to specifically diagnose the function of these little vessels, and to also test for something called coronary vasospasm, which is more common in women compared to men.
Oh, wow. Okay. So help our audience understand, because I was one of those kids that I halfway paid attention in class, but it wasn't always. So the word ischemic, help our audience understand what that means as it relates to heart disease.
Yes, that's a really good question, Ellis. So heart disease can be composed of a lot of different problems. It can be a problem of the heart being weak. We usually call that heart failure if the heart is just not pumping well. But a large cause of mortality from heart disease is due to heart attacks. And in heart attacks, it's an acute situation of ischemia, which is a term that means there's lack of blood flow going to the heart muscle. Imagine the heart muscle requires a tube of oxygen, nutrients, blood, all that's in blood to allow that muscle to work. And traditionally, a heart attack that we think of in men, but also in women, is when there's a big blockage that's blocking that tube. So then your heart muscle can't get enough oxygen, and then you have a heart attack. But sometimes people can have just persistent chest pain due to dysfunction of the tube. That tube is not allowing adequate blood, oxygen to go to the heart muscle, and therefore we're able to see those signs either on abnormal stress tests. Blood tests might be abnormal if there's actual damage to the heart due to poor oxygen to the heart muscle.
Okay, thank you for that. I needed that. Help me out. Help us out here. So, I'm going to call out the elephant in the room, and we're here on blackdoctor.org. And so we're going to talk about, the next question is for either one of you to take, is that we've noticed that there's a disproportionate number of women of color, Black and brown women, that have heart disease. Why do you think it's so prevalent in women of color? Is that due to kind of past biases that's kind of still impacting it? Is it because of social determinants of health, and we're talking about neighborhoods and having fresh foods and vegetables available, pollution. There's all these other things. Is it all of the above? Maybe I answered my own question, but is it all of the above? Why is it so more prevalent in women of color than white?
Dr. Way can take this because she just published a paper in Circulation.
Yeah, so this is a very good question. We have actually tried to study this, and I always say the quick answer is a little bit of all of the above. Certainly social determinants of health. There are risk factors that are seen to be more common in Black women, Hispanic women. And, it's interesting when you break it down by looking at women who present with a heart attack due to big blockages versus no big blockages. There are definite increases, higher rates of mortality in Black women when they present with those type of heart attacks. When we analyze the Women's Ischemia Syndrome evaluation, or the WISE study, when we look only at the women who had no blockages but still had chest pain, still had evidence of poor blood flow to their heart, we actually did see that they had higher rates of mortality. They weren't getting the medications when they were presenting with these conditions. So part of it may be that they're just undertreated, underdiagnosed when they're presenting with chest pain. On the other hand, when Black women were having similar presentations as white men, for example, or white women, where they had the typical type of heart disease where you got big blockages in the arteries and were getting treatment, actually the mortality rates were not different. So I do think that part of it is underdiagnosis, undertreatment, and social determinants of health contribute to that. But also we need to recognize that the conditions that are not traditional, man's type of heart disease, like when people present with chest pain or heart attacks with no big blockages of the arteries, that has definitely been shown to be higher prevalent in Black women compared to white women.
Okay, that's good to know. All right, so there's some things that we can have some control over. In that, again, education, and Cynthia is going to share her story, and that's why we're doing this program. All right, so we've talked about all the problems, right? I gave a list. We talked about risk factors. We talked about warning signs, research. All right, let's talk about something that is positive. What are some steps that women can take to improve, to take today to improve their heart health overall?
Cynthia probably knows. You're doing so well.
Absolutely. Well, I was inspired by the greats, you, Dr. Barry Mertz, and Dr. Way. For me, it's making sure that I have an ample supply of leafy greens in my diet and berries. It's making sure that I work out at least 30 minutes every day. Some kind of cardio. I'm incorporating some strength exercises in there as well. But I think more than anything, it's just, for me, it was taking responsibility for my health. It was understanding the experience that I had had and owning it and taking responsibility for it. So every day I have tons of leafy greens and all kinds of things that definitely keep me in the right direction. Being aware of my numbers. I take my blood pressure every morning and every night, so I know what my numbers are looking like. I know when I've gained 2 pounds overnight. That's an indication of water retention. And so I make sure that I pay attention to the ankle swelling and things of that nature, so that if I am retaining more water, I take the correct doses of pills to get rid of the extra fluid so that my heart doesn't have to work as hard. Am I doing all right, ladies? I've been well taught, no doubt about it.
So let's stay there and let's talk about your story, Cynthia. You said you thought it was heartburn. You got some chest pain. You thought it was initially heartburn, and then it turned out to be much more.
Yeah, exactly. I woke up. I had this severe burning in my chest. I thought it was heartburn. I went to the ER and they did an angiogram. And the first time they did it, they didn't really see anything. The second time it happened, I had a vasospasm while they were doing the angiogram, and they understood then that I had this situation that Dr. Wade was speaking of, where I have this artery or vein that tightens and restricts the flow of blood to my heart. So understanding that, um, th- th- that's how we figured out what was going on. Fast forward, they did the troponin test to see what my troponin level was in my blood, and that's how they knew that my heart was having some issues. Um, Shortly after that, strangely enough, um, I had actually come from work to just take my puppy dog to get a shot, and I collapsed. I was fortunate, very blessed and fortunate that I was in the company of someone who knew CPR. She
Oh,
did
wow.
CPR for 15 straight minutes, and she kept my heart going. She was basically my heart and my brain, if you will, for 15 minutes.
Wow.
And in the meantime, because I'll backtrack for a second and say, because of the experience I had with the angiogram, I was fortunate enough to be invited into the Women's Heart Health Study.
Okay.
So I already had kind of adapted somewhat of a relationship and a history with Cedars and the women's program. So they kind of knew what was going on with me. When I collapsed and they got me to the hospital, Dr. Way was immediately on the scene and they immediately started taking care of me. They reduced my body temperature to make certain that my heart didn't have to work to support the other organs of my body.
Mhm.
Uh, they were on it. And I mean, I feel very fortunate to have been a part of the Women's Heart Health Study because I think that's the connection that truly saved my life. Um, they got me in. Dr. Wade made sure that everything was taken care of. Dr. Barry Mers was there. I mean, they literally handheld and made sure that everything was taken care of. There was never any drug administered. And you have to understand, this is over the Christmas holidays and
Mm.
everybody's getting together with their family. Dr. Way has a fairly new baby. Every time they got ready to make a change of any sort with my medication or any other process, Dr. Way was there. She literally had gone home and came back because of something they were about to do. She wanted to make sure it was handled properly. And literally in 3 days, people were walking past my room saying, "That's her, that's her." And I didn't really understand what that meant. And they told me that basically you're the Cedar Sinai Christmas miracle because they couldn't believe how quickly I had recovered. Um,
Mm.
and that's all to the knowledge, the dedication, the commitment, and the care that I was given by these two ladies that are on this panel. It truly was a phenomenal experience. Because of that, I've become more aware of what's going on with my body. And when someone works that hard to save your life, you feel like you have a responsibility to take care of your life, right? So
Right.
that's what I do in every way I can. That doesn't mean I'm perfect because yes, I will have some food on occasion that I probably shouldn't. But I've learned moderation is the key. And also moderation and awareness, being
Right.
aware of what's going on with your body, responding to that, taking responsibility for it. I'm in a very stressful job and I'm moving all the time. And I think that more than anything, it's made me slow down and take account of what's going on with myself. There have been occasions when, because of this process, I have a defibrillator in
Okay.
my chest that's been implanted. And so anything wacky or wonky that goes on, they pretty much know about it because there's a monitor that downloads everything that's going on with my body 24/7. And they're very responsive. If there's something that happens, I'll hear Dr. Way say, "I looked at your report and there was a little bit of this going on." It's kind of funny because that is the relationship that I have with the Cedar Heart, Women's Heart. And I can only say that from my experience, everyone that goes through that program is gifted by the knowledge that these ladies take painstaking time and energy to make certain that they know about what's going on with women's heart so that we can be better surviving it as opposed to dying from it.
Well, that's a fantastic story, and thank God that you're still here with us to be able to share that story.
4 years.
And
4 years.
counting. More to
4 years
go.
and counting. December 18th of 2018 was when it happened. And 4 years later, I stand strong and I continue to do everything that they tell me to do. They can't get rid of me. If I don't see them often enough, I just call them just because.
Yeah, I think, Cynthia, your story also just, I think two things also, people took you seriously, right? Because you thought, this is odd, this chest pain, this heartburn,
No, it was
it's not
heartburn.
getting better with heartburn
Mhm.
medication. And,
Right.
and then you took also the initiative to find out, what's going on. This is, heartburn shouldn't be causing a heart attack.
Right.
And so I think it's listening to your body, listening to your symptoms. Something is not right. Try to get the answers. And if you're not getting the answers, do seek for a second opinion. And so that was, I think, an important lesson from your case. And also, thank God for the CPR, right? Because, and then everybody now knows with Damar Hamlin's event, how important it is to learn CPR. So everyone, look to a local organization, to learn how to do CPR.
It saved me.
You'll save somebody's life.
Absolutely,
Sorry.
as mine was.
Mm-hmm.
And it's not easy to do. In fact, I learned CPR after this incident because God forbid I not be able to save someone's life after my life has been saved.
Right.
Yeah, you pay it forward.
Absolutely, in every way.
That was why I was like, yeah, there's that piece of why it's important to get CPR certified, CPR trained, even if it's just compressions, right? Because that could be enough. You may not be able to do the breath, but compressions can be enough to save somebody until you get emergency care there to you. So Cynthia, you say it's been 4 years, and we hear as lay people, a lot of times our doctors say, you need to make a lifestyle change, right? And that is something that's far easier said than done.
No doubt.
What was that process, that lifestyle change like for you? What were some of the challenges? And then when did it finally kick in for you where it became part of your routine and you kind of made that shift to, I might cheat every once in a while, but I'm primarily eating leafy greens and berries and things that you mentioned earlier?
Well, I think for me, it was because I'm always on the go with my job. I think for me, it was trying to find a way to accommodate what I needed to have in my body and still maintain my schedule. And so understanding that I'm never necessarily in front of a plate at 7 o'clock or at lunch at noon, I decided that I did some research and I know that leafy greens were important. So what I do is I have a NutriBullet that I actually grind up kale, green chard, spinach, strawberries and blueberries. And I do a shake every morning so that if I don't get any meal in me, I know I got what I needed in me.
Gotcha.
Right. So I get 3 servings of leafy greens. I have berries. I try and minimize the sugar. So it's very little orange juice I'll use because it has high sugar. I try to be very conscious. I've become a label reader because that's really what you have to do, because unfortunately in our country, it's buried in the label what's really going on, even if it's diet, low sodium, all of the things that they say. You really have to kind of find ways. I use a lot of herbs as opposed to salt and things like that to flavor my food. And I just try and be conscious of the fact I went to cardiac rehab for several months to strengthen my heart. And I had kind of fallen off the bandwagon for a minute. And one of the techs at cardiac rehab called me and said, when you were lying in the hospital in the ICU, you would have given anything under the sun to be able to walk or even ride a bike. And you need to focus on that moment, because that moment will get you up every day and get you on that bike and get you walking. And that is what has kind of inspired me. I always reference to that moment, understanding that I could not be here. And so, we're human.
Right.
So we get involved and we do, when you go out with friends or whatever, you want to be mindful of what you eat or anything like that. But I minimize. I just decide that you get one cheat day a week. And that doesn't mean that you get to cheat all day. You get one cheat day, you get one cheat thing. And that's what you do. And you stick to it. Initially, it was probably 2 cheat things. And then we work our way down. I had to really kind of step the lifestyle down. I didn't get out of the hospital and go, okay, let's go. We got it. It was not
Right.
that. It was not that. You have to learn how to change your habits. And it happens over time. So I will say it probably took me a good year to really get into my routine and be committed to it, because lifestyle change doesn't happen overnight.
Right.
And when I say a year, it was gradual things, giving
Right.
up things, wanting to say every month, I'm going to give up something, and then replace it with something that's better for me.
Right.
So that's kind of what I did.
So it sounds like there was incremental change, and that's so I really want our audience to recognize that what Cynthia is talking about is incremental change, not dramatic, not 180. It is incremental. It is and give yourself grace if you have a bad day, right?
Yeah.
I won't tell you what I had for lunch today, but it wasn't good. So I had to give myself some grace. And I
Yes.
said, okay, you know what? I got to eat better for dinner because of what I had, for lunch, and make sure exercise. And so that's the thing when we're talking about. So Dr. Way, we hear people talk about exercise, and that's kind of a dirty word sometimes when people say that. It's like exercise, and we all cringe up when we hear the word exercise. And then the word movement is being used as a supplement to say so really help us understand what that is, because Cynthia's talking about 30 minutes a day in terms of some sort of exercise or movement. How does that play out, and how can people incorporate that in somebody as busy as Cynthia that's not in the same place? How can somebody incorporate that movement into their lifestyle to where it makes sense and it's healthier for the heart?
Yes, thank you for asking that question, because I'm actually one of the people where when you think of exercise, I'm like, oh my goodness, how do I fit that into my busy schedule? I've got two toddlers, full work day. And it really is trying to make it part of your daily being. You've got to think, all right, if I don't have severe knee pain or back pain, I'm going to take the stairs to go up the flight instead of the elevator or going down the stairs. I'm going to park far away so that I can walk that extra, 10 minutes or 15 minutes every day back and forth from work. I'm going to try to, instead of, we're all used to probably virtual meetings, right? I'm going to try to, after this, get up and stretch. And if you are not the type of person who says, I'm going to, jog or walk for 30 minutes, then try to break it up into 2 times, during the day, where you can spend, shorter increments, 10 minutes, and make those minutes count. Instead of doing a leisurely stroll, do what we call more high intensity interval type of exercise, where you're actually breaking into a 30-second, fast walk, or doing some jumping jacks, or doing other types of resistance training that just, requires a couple, 10 reps. Just building that throughout your day when you're not able to dedicate time to a gym or to an exercise program where you're going to be getting a sweat out. We really just want you to get your heart rate up, get all your muscles moving, because it really is the whole body. The whole body benefits from exercise, not just the heart. Your brain benefits, and that's probably the number one reason to exercise. Is exercise really does help prevent dementia and prevent heart disease. So think of, some of that longer term benefit as well.
I'm going to give you my cheat.
Okay.
There's so much content out there on
Right.
your phone, on your iPad. I get an episode a day of my favorite series. Okay. If I'm going to binge watch a series, instead of binge watching it, I'll get on the bike and I'll watch one episode. It's distracting, and before you know it, you're so engaged in the show that you forget that you were working out. And so that's my cheat. I just decide what I'm going to watch, and it'll take me forever to watch it, but that's what I do. And then I go, oh, I got to go back and watch the next episode. So it's not, I got to go get on my bike. I got to go watch the next episode. It's a mind trick, but anything you can do to change your perspective certainly helps.
It's great advisement.
Mhm.
That's what I do in the morning. I get on the elliptical and I watch a YouTube. I'll catch up with Saturday Night Live, or I'll watch a documentary. Yeah.
Exactly.
Or yeah, listen to like an audio show, a radio talk
Yeah.
show, or
Yeah.
so many wonderful podcasts now that you can kind of catch up on the outside
Exactly.
during walking or exercise. That's a great idea, Cynthia.
That was fantastic. Yeah. So, and I would just add this is that when you get started, because I know that's always the hardest part is just cracking the label, getting it started. Once you get started, one, it's not going to be day one. I feel great. Oh, it's over. It's day one, day two. But over time, I guarantee you, your diet is going to change automatically. Because if you're still eating those bad foods, those exercises are not going to feel the same. And so you say, wait a minute, if I put some better fuel in, then the results start to improve. And then it goes hand in hand. I'm speaking from personal experience. I'm taking my host hat off. I'll put my personal experience hat on this. And so I have less desire to eat those heavy carb-laden, sugar-laden processed foods, because I know I'm going to feel it when I ride my bike. I'm going to feel it when I get on the elliptical or go and try to take that boot camp class. And I look like I've been doused with a bucket of water because I can't get through it because I've been putting the wrong fuel. So think about it like your car. Your car has an octane range on there. And it says for optimal performance, this is the fuel that needs to go in there. If you put a different type of fuel in there, you're not going to get the optimal performance. Your body is the same way. And so it really will start to change. And we're talking about developing habits. And what Cynthia just talked about was pairing a reward with the habit, right? So the reward was I get to watch my show, right? You probably want to watch the show more than you want to get on that bike.
By far.
But you know that the reward for getting on that bike is I get to watch my favorite show. And so therefore now you're paired a reward with the behaviors. And so that makes the behavior a lot easier to do.
I think the other thing too is deciding, because the day gets in the way. So for me, I have to do it in the morning because I can have the best of intentions to do it later on after work or whatever. Something happens. Oh, I'm late for this. And all of a sudden your workout goes away. So if you do it first, the great thing is the rest of the day I go, I don't have to do that now. I get to enjoy the rest of my day without the pressure of knowing that I still got to get on the bike. That and also just really kind of understanding that when you do this, it changes who you are, right? You start to look different. People start to talk about you differently. Oh, you're looking good. All of those things reinforce, ego or not, it reinforces how you feel about yourself, right? And that's a habit then that you start to want to repeat. I don't want to eat the double cheeseburger. I don't want to eat, I want to keep that going because as people notice when you lost, they also notice when you gain. They're going to go, like you slipped a little bit. I see a few LBs there. So you got to see it. It's all in the mind. I do believe that the body can do what the mind tells it can do.
Yeah.
I learned that running a marathon, and I kind of use that principle in changing my habits. The body can do what the mind tells it can do. And I think the biggest leap for me has been understanding what my body can do in this new capacity, because I don't have the capacity I had before. There are some things that I don't do as well as I was able to do before. And that is a real mental leap. Instead of being depressed about it or I'm not who I was, I embrace who I am and understand that within this space that I'm in now, all of the things that I can do, not the things that I can't.
Yeah, I used to have, my mom used to tell me all the time, the most productive day of the week is tomorrow. Because that's what everybody said. Well, I'm going to do it tomorrow. I'm going to do it tomorrow. Tomorrow is the most productive day of the week. Everybody puts everything off. So don't procrastinate. Get it done today. If you can do it today, get it done today. You'll feel
believe me, I wanted to do something tomorrow when I collapsed. So let's focus on the fact that you don't know what tomorrow is. So
let's do it today. Absolutely.
Yeah, let's do it today.
So Dr. Barry Mertz, I'm going to shift just a little bit and talk about, because we hear blood pressure and we know high blood pressure disproportionately impacts people of color. Uh, what role and what should we be looking for in terms of the changes in our blood pressure that could indicate there's something going on with our heart health?
Yeah, Ellis, this is such a great question, and I was wanting to make this shift as well because, lifestyle works wonders, but it's about half of the recipe for prevention and reversal of heart disease. The other half is medication, and the blood pressure medication that we have now is modern, it is safe, super safe, and it's generic. I mean, there are grocery stores that will fill these prescriptions for free if you come in and buy a quart of milk.
Oh, wow.
This medication is so inexpensive, and it most of the ones that we use now, they essentially have no side effects. So there's just kind of no reason why people shouldn't have good blood pressure control. And as you point out, our patients of color suffer disproportionately from this,
Mhm.
and they're the least likely to be offered blood pressure medications. And then there's the other side of the coin, they're least likely to take them.
Mm.
And so this, again, you're doing some really good community education here, because you've heard from cardiologists who care and also know the data. You're hearing from Cynthia. I mean, half of her recipe of 4 years and many to come success, half of that is medication that she takes every day. And I bet she's pretty religious about it because she's taking her blood pressure twice a day. So, and then the last thing I'll say is to expand it a bit, just to make sure we cover the cholesterol pills.
Yes.
We have 2 lines of medication that, again, this is another one. They're so cheap. Some grocery stores will give them away for free if you come in and buy something. And yet they're so safe. And like managing blood pressure, they will reduce your risk of heart disease, of dying from heart disease, of having a stroke, of becoming demented. These things will reduce your risk by 50%. And it's alarming how great it is, and yet nobody knows about it, and somehow we don't deploy it in people enough. So thank you for your attention to it.
Absolutely. Absolutely. So, Dr. Way, cholesterol, that's a bugaboo, right? So we talked about blood pressure. Let's talk about it. We mentioned cholesterol. That's a bugaboo. HDL, LDL, we hear all the letters. What really is a good cholesterol number that we should be shooting for, and getting it below? And then what are some ways that we can clean some of that cholesterol out of our system? I get people to understand what cholesterol is in terms of how it sits in the bloodstream. Is Black folks know what I'm talking about. When you make that bacon, right, and you got your bacon drippings left in the pan. If you leave it in the pan, it gets white and hard, right? That's what happens in your heart when you eat those fatty foods, right? That what happens in your blood vessels, and it sits in that, and then it starts to get hard, and it starts to clog that blood vessel because it starts to build up in certain areas, and the blood gets harder to go through, and then we can get that blockage that Dr. Way was talking about, and that's when we have real problems. We have blockage. So, Dr. Way, how can we reduce that cholesterol, and what role does it play in our heart health?
Yes, yeah. So when you go to your doctor and you get your cholesterol checked, usually what the panel consists is of the total cholesterol, the LDL cholesterol, which is the bad cholesterol. That's the one that you want to get low. So L for low, you want it to be low. The good cholesterol is the HDL. That's the high density cholesterol. That's the one that you want to be high. But we have evidence that if it's really too high, it may not be as protective as we thought it used to be. And then you'll have triglycerides. So those are kind of the 4 cholesterol numbers that you're given. The ones that we have found to be most predictive of heart disease, of stroke, is the bad cholesterol. It's the LDL. Okay. So normal, healthy cholesterol, really you want your LDL cholesterol ideally to be less than 100. And so if you've got one of those other risk factors that I mentioned, high blood pressure, if you're smoking, if you've got diabetes, if you've got family history of heart disease, definitely know your numbers. And your doctors can now put your numbers, your age, your sex, if you're Black or white, or if you have high blood pressure, into a risk calculator. The American Heart Association and the American College of Cardiology have a pretty good kind of risk estimation for your risk of a heart attack or stroke over the next 10 years. So ask your doctor, what's my risk? You know my numbers. What is my risk for having a heart attack or stroke over the next 10 years? And they can give you an estimate. If your estimate is high, then you really should be on cholesterol preventive medications, as Dr. Barry Merz said. These are cheap, easy to take medications once a day that really help lower your risk of a heart attack or a stroke. If you're kind of in the intermediate risk, there are also additional tests that can be done, and you can talk to your doctor to see if you're a candidate for something called a coronary calcium scan. Coronary calcium scan is a 10-minute CT scan of your chest that tells us if you have already some calcifications of your arteries in your heart. That's what this coronary calcium is looking for. And studies now show that this is probably the other best kind of preventive screening test that we have for heart health. Not everybody is a good candidate for it, so just talk to your doctor to see if you're a good candidate for it.
Absolutely. Fantastic. So, doctors, what did you learn from Cynthia, and what can our audience learn from Cynthia and her story?
I think, Cynthia, she benefited from community education, meaning the CPR component. She benefited from physician education. She was taken seriously. She benefited from her own advocacy and making sure that she was getting the right care. And I think these are all incredibly important messages that if we can get the message out, and if people as community members, make this a goal to eradicate heart disease, which we could do between the lifestyle that we've discussed and these medications, we could do this. We just need the will to do it. That would be my answer.
Dr. Way?
And I'd like to just add to that, in addition to what Dr. Barry Merz said, one thing that I really appreciate from Cynthia is that trust. We both listen to each other, but I appreciate that she listens to us as well. She usually says, what, doc, I trust you. If you think I need to increase my this medication, then I'll do it. But we also, in return, listen back. If she's saying, I'm feeling dizzy, this doesn't feel right, then we say, all right, let's take a look at your numbers. So I think it's very important for all of you to really find a physician, clinician, care provider that is listening to you, and then that you can develop a trusting relationship, because they're the ones that will take you seriously. And you'll also learn from them to see, maybe this condition needs to just take the next level to be on a medication or do a test. But without that trust, it's hard to move forward.
So I'm going to say that in layman's terms. That means you can't just present to the emergency room when you have a problem. That means you have to go to a regular care and have a relationship with the physician on a regular, ongoing basis. That's how trust is developed. Trust is not developed an emergency at a time. Trust is developed by you coming in and showing that you're going to be adherent, and showing that you're going to show up for your regular, okay, if I'm coming on your block, just say ouch. If I'm coming close to home, you have to have that relationship, because that relationship and that trusting relationship is going to get the kind of care that you heard Cynthia describe today. And so that they trust that Cynthia is going to show up. They trust that Cynthia is going to call. They trust that Cynthia is going to be the type of patient that they like to have. And so that's that two-way communication, and that two-way. We've got to do our part as lay people. We've got to do our part. That means reporting and learning our family history, reporting it to our doctors so they know, okay, here's something I should be concerned about. They got a family history of high cholesterol. Maybe I need to pay attention to their cholesterol numbers, and so on and so forth. I'm going to get off my soapbox. But again, trust is built on an ongoing relationship between two people, and you've got to go to your regular primary care physician on a regular basis to develop that relationship. Whew, okay, all right. I blacked out there for a moment. I get it because I'm speaking from personal experience because I was one of those people. All the time I showed up with urgent care, and if I had a problem, and I didn't develop that, and you can't build a good health history because they start asking you, what's your health history? I don't know. I had a problem. I went in, they took care of it. I left, and I didn't go back until I had another problem. That's not the way we should engage in healthcare. The way we engage is ongoing, getting those checkups so they can start seeing if those numbers change over time, so they can get ahead of it instead of an emergency situation. So, whew, all right, I got on it again. You see, y'all got me excited over here. All right, so
Well,
after-
I would add one thing, Alice, to what Dr. Way said, which is healthcare provider. So a lot of this prevention, blood pressure management, cholesterol management, counseling for exercise and nutrition, that can often be done by nurses, nurse practitioners, physicians' assistants. So people, and many of our community centers now for health centers with Obamacare, they are staffed predominantly by nurses and allied healthcare professionals. And for prevention, not for a heart attack, but prevention, those are very qualified people to work with. And that's another level of trust.
Absolutely. Fantastic. All right. So we're coming up to the end. We had some great comments. Cynthia, you're a rock star. People are just they really put in the comment section a lot of support for your story. I'm going to say on behalf of Black Doctor and that we are really pulling for you. So you've got another team of people that are champions. We want to get to 4 years and beyond. You're at 4. Let's take it even farther. You're on the right track. It seems like you're happy, healthy, and we're going to continue to pray for your health. Dr. Barry Metz, Dr. Way, y'all are fantastic. This has just been a wonderful program with some great, rich information. It's a lot, guys, but this is the battery. This is the engine of your body, right? So this thing never stops. We can sleep. It's got to keep pumping, and we got to keep this thing going. And so we know, we heard the numbers tonight, number one killer, right? And it's impacting women even more than men. It's impacting it has a greater impact even than breast cancer. And we know we hear about breast cancer, we wear our pink, that's great. But this is having a greater impact. So we really have to do what we can in order to make sure that our heart is healthy. And Dr. Barry said, hey, we can get rid of it. We can get rid of it. But
Yeah.
we've got to come together, and we've got to do what we need to do. So I just want to thank our partners at Cedars-Sinai. This has always been a wonderful partnership with you all. I'm going to say thank you again to Dr. Barry Metz and Dr. Way and our amazing patient, Cynthia Mayweather, for joining us today. At the beginning of the program, I promised you a conversation that could possibly save your life. And I think we delivered on that promise. Remember, know your numbers, right? Got to know your numbers. Know your risk factors. What are your risk factors? And know your symptoms, right? And we talked about earlier in the program, if you're a woman watching this program, some of your symptoms might be different than that traditional symptoms, right? Talk to your doctor, right? Preventative care, you can go to your care centers and see a nurse practitioner and whatnot. Remember, talk to your doctor, and remember that early detection saves lives. We'll be sharing some more resources in our chat, so make sure you check those out. Thank you so much to Cedars-Sinai and for all of us here at blackdoctor.org and Daily Vitamina. We wish you a happy and heart-healthy evening.
Thank you.
Thank you.